Welcome, viewers and listeners, to the COVID-19 update for today, January 8, 2022. I will be speaking with the Minister of Health, Dr. Frank Anthony. Minister Anthony, thank you for joining us this morning.
Well, thank you for having me on the program this morning.
All right, Minister, let's start with the number of cases recorded in the last 24 hours and our current active cases.
So over the last 24 hours, we had 141 new cases. And we have currently 5,103 persons with active COVID. Again, these numbers are going to come down because we're seeing less persons testing positive, and those who have been tested already and have been isolated, more of them are being discharged.
Okay.
So the 5,103 persons that we currently have, these numbers are going to come down over the next few days. In addition to those who are active, we have right now 94 persons who are in hospitals, and of the 94, 69 of them are at Ocean View, with 16 of them in the ICU.
All right, Minister, for those persons living with HIV and are still hesitant to take in the vaccine, can you say if it is safe for these persons to get vaccinated?
Well, it's important for everybody to get vaccinated, and especially if you have an underlying illness. HIV is one such underlying illness, and therefore we would encourage everyone to make sure that they're vaccinated. Currently, we have, or we estimate that we have 9,081 persons who are positive for HIV. And of those, during the pandemic, several of them did not come back for treatment. So we have approximately 2,400 of them that has been lost to follow-up, meaning because they're not coming back for treatment, it's difficult to locate them. So currently the HIV population in Guyana that we are working with in the public sector is about 6,681. And of those persons, we have at least 5,224 of them would have received a first dose vaccine, which would be approximately 78.1% of that population. And in terms of second dose, we've had 3,839 people. That's about 57.4% of the persons who got vaccinated. 57.4% got their second dose. Now, we want to encourage people to get their booster shot because with HIV patients, several of these patients, their immune system might be depressed. And in other countries, the protocol would have been not just one booster shot, but a second booster shot because of these patients' vulnerability of getting COVID because of a depressed immune system. So again, here in Guyana, while I would say we have done relatively well with immunizing our HIV patients, we can do better because at 78% for the first dose, we still can take that up. We want to get that up as much as 90%. And of course, we want the second dose to also go up so that we can get people closer to that 90% mark. And to make sure that these patients get their booster doses as well.
All right, Minister, as we're speaking about persons living with HIV, can you say if there is any evidence that these persons have a higher rate of side effects after vaccination or any unusual side effects?
No, it's like any other patient. So generally when you get vaccinated, depending on your individual makeup, some people might experience a little bit pain at the site of the vaccine. Some might get a little bit of fever, you know, these are typical things that people would get when they're vaccinated, and it doesn't matter whether you're HIV positive or not. So people would experience the same kinds of side effects. These are, however, temporary, and within a 24-hour period, you should be back to normal. And most people, if they have some pain and fever, they can use paracetamol, and they'll be just fine. So there's nothing different if you're a HIV positive patient.
All right, Minister, what about children under 12 years old? I know they wouldn't be able to take the vaccine, but what would you say parents can do to keep them safe?
Well, the main thing here is that if there is a child that is below 12 and is HIV positive, then parents should make sure that the child is on their antiretroviral medication and that they're able to suppress the HIV virus. If they're doing that, then the chances of the HIV virus compromising their immune system is relatively small, and therefore, apart from that, that's the first thing that they need to do. But apart from that, they need to follow all the public health measures that we have put in place, including wearing masks and sanitizing and keeping social distancing and so forth. And once you abide by those consistently and correctly, you should be fine.
Okay, Minister, can you say how many vaccines we have administered within the last 24 hours, and what is our vaccination numbers like?
So in terms of vaccines, over the last 24 hours, we would have done about 1,867 doses. This would include for adult and for children 12 to 17, and also booster doses. We generally have seen over the last several days that for the 12 to 17, it's about 100, just a little bit more than 100. Older persons are coming forward to get the vaccine and the booster doses, but we are not seeing the same uptake with persons 12 to 17. And again, I really want to encourage people to make sure that they get vaccinated. Today's COVID numbers, basically, we've had for adults, first dose, 426,841 persons who would have received a first dose. We are now at 83.2% of the adult population. And second dose is 318,677, or 62.1% of the adult population. In addition to that, for children between 12 to 17, we have first dose 32,921. That's 45.1% of that age cohort. And we have 23,466, or 32.2% of that age cohort receiving a second dose of the vaccine. Booster doses have gone up slightly. We are now at 43,154 booster doses. And we really need to move this up very quickly so that we can prevent people from getting sick with the new variant.
Thank you, Minister, for joining us this morning.
Okay. Thank you.